I chose social work because it's rewarding, it's broad, you can kind of go anywhere with it, and I love helping people.
I knew I wanted to work in the healthcare industry. Medical imaging has a lot of room to grow, there's a lot of variety, more education that I could continue to go on and do, and so all those reasons brought me to radiologic science.
I chose my major because I've always wanted to help people. I've had a passion for healthcare for as long as I could remember, and I met the faculty in the respiratory therapy program, and they really cared about their students' success, and they just seemed really excited to have all of us there on our tour, and so I thought I'd apply, and I fell in love with it.
It sounds really cliche, but I chose nursing because I wanted to be in a position where I could help people. I've always had a passion for being in the medical field, and when I first came into college I thought that was through veterinary medicine. But I found that working with people was sometimes easier than working with animals, so I chose nursing and I haven't regretted it since.
I chose my major because I've been invested in sports my whole life, and I had a really good health sciences teacher in high school who kind of pushed me to kinesiology.
I've always been interested in health and disease, so public health allows me to look at it from a different traditional treatment lens, more from the prevention lens. So it allows me to kind of balance my interest in disease while being able to prevent it rather than treat it.
Yeah, so I chose Boise State. Well, it's kind of a funny story. My parents were going to move to Boise after I graduated high school, and the rebel side of me was like, no, go off and do your own thing. So I went and toured other schools, and I liked them, but my parents were like, just go to Boise, see if you like it. So I did, stepped on campus, and I fell in love. I knew that Boise was home as soon as I came here, and I couldn't pass up the opportunity to become a Bronco, so I chose Boise State.
I chose Boise State because I'm from Idaho, and I thought it was a really cool opportunity to move away from home but still be in state, and Boise State had everything that I wanted. It had outdoors while still kind of having a bigger city feel, and when I walked around campus it seemed like everyone had a passion for Boise State, like everyone was excited to be there. All the faculty that I met was amazing, and all the resources that Boise State provides to their students seemed like something I was really looking for.
I chose Boise State honestly just because of the location of it. It's pretty close to home, but also the campus itself is right next to the river and the Greenbelt and downtown, and I really like just going up and down the Greenbelt and just finding new places. You can just go up and down as much as you want.
I grew up in Eastern Oregon, and my family always cheered on the Broncos through many sporting events, especially football, and so when I knew that they had a program that I was really interested in, it just felt like the right fit.
I chose Boise State because I love the community and it's kind of close to home.
Boise State was the perfect balance for me, the perfect distance from home, it was affordable, and it allowed me to be flexible in my plans and have a lot of stuff to do in a bigger city.
I really like how I can take something I learned in class and 5 minutes after being able to apply it in real life and seeing just even how I walk and noticing the faults in how I walk. I just really like that.
The thing I like best about nursing is the fact that it's very much a technical degree. So even in your first semester in pre-nursing, you're learning a lot of things about nursing through anatomy and physiology and chemistry and all of that. And then once you're in the nursing program, it is very much so more focused on what you want to do in nursing. And when you graduate, you know you're going to be a nurse. Maybe not what field you want to go into, but you already kind of have your job lined up, which is a really cool thing.
I like the small class size. There's about 25 to 30 of us. I've made a lot of friends throughout. It is a very hands-on major, and we have a lab. We get to do a lot of exercises in and learn exactly what we're going to be doing when we go to the clinical site. So very prepared, and I have enjoyed making a lot of friends.
I'd say the overall flexibility. So you get a good basis in the public health major of all the sort of work you need to do within your community, but it also allows you to have a little bit of wiggle room for your interests.
What I like best about the major is probably the program. It's really small and you get to know all of your classmates.
I hope to go get my master's, and then I hope to get some sort of research job. I'm not sure what I want to research, but take it up that path.
So after graduation, step one is to take the NCLEX and hopefully get my registered nurse licensing. And then after that, I am not quite sure. I've thought a lot about working in pediatrics. I've enjoyed my clinical rotations there. This coming semester in my clinical preceptorship, where we do 200 hours in the hospital, I'm hoping to do it on the pediatric floor at St. Alphonsus. So I'm hoping that kind of cements the fact they want to be a pediatric nurse, but I don't know yet, so still up in the air.
After graduation, I would like to continue on to another modality. I'm thinking about ultrasound, nuclear medicine, and then I can also work as an X-ray technologist right away after graduation.
I've accepted a spot at Emory University for their Master's in Public Health program in epidemiology, with hopes to be an epidemiologist in the future.
After I graduate, I hope to go and get my master's in social work and then work in a hospital as a clinical social worker.
I hope to graduate, pass my boards, and then work in an intensive care unit. My favorite Bronco experience has probably been being an orientation leader. It was super fun last summer to get to work with new students and to help them adjust to their Boise State journey, and to kind of see them grow throughout the fall and spring was really exciting. And then I get to do that again this semester, so welcoming students in person, I'm really excited about that. But it was just awesome to wear the orange polo and to get to hang out with new students all summer.
I would say my experience with the Honors College, I just got to meet a lot of cool people. From my closest friends have been from there.
My favorite part about being a Bronco is that Boise State has the feel of being a small school, but then you go to football games and basketball games and it feels like you're at a big school. So it's really cool that way. This last year, our basketball team went and won the conference title for the first time in, I think, ever. And it was really cool to go to those games and cheer on the team, especially because basketball is my favorite sport. So it was cool that they were good this year.
I think the classic football game has been my favorite Bronco experience. I love going out to the blue field and cheering on the Broncos. It's my favorite.
My favorite Bronco experience is probably the first week of campus. Like on my first week of campus, just being on my own and meeting so many people and meeting friends that I still have to this day. I think I really like that.
Working at the rec, I've met a lot of really good people and I've met some of my closest friends, and it really gets you involved in the Boise State community, and honestly, who doesn't love fitness these days? My favorite academic experience would be my freshman year taking Sociology 101. My professor was amazing and she did all of the assignments and stuff on hand, and honestly you really learn a lot about things you probably didn't know about before. And so her class was actually really just amazing, and that was probably my favorite academic experience.
My favorite clinical experience was my remote clinicals at Duke. I got to do 36 hours of clinicals there. I got to be in 5 different units, which was really cool. I got to see the pediatric side as well as the adult side. And I got to see what respiratory therapists do in North Carolina and not just in Idaho. So I thought that was really interesting to see the difference in scope of practice, and it was a really cool learning opportunity.
My favorite experience is probably working at the biomechanics lab, and just becoming invested in that program and just exploring my major, because it's what I care about. So
I would say my research at the Center for Health Policy. I focus on maternal child health and rural healthcare needs.
I think my favorite part of the nursing program are the simulations that we do. They set it up like you're in a real hospital scenario. That's something that you might see in real life. And it's really cool that way. So you really test your critical thinking skills and what you would do if you were a nurse. In one specific example, the one that I was the primary nurse, we went into the room and the patient was severely dehydrated and potentially going into hypovolemic shock. Basically meaning if we don't start fluids right away, they might die. So we started fluids and we were able to see their vital signs stable out, and even though it was a mannequin, it kind of felt like you were saving a life, which was really cool. So that was probably my favorite.
My favorite thing about this program so far has been my first clinical experiences at the VA. I am a veteran. I was in the Navy for 5 years, and I really enjoy working with the vets. It's also been a great place to learn and grow. They've treated me really well, and hopefully it will open doors for an employment opportunity in the future.